Begin.
Okay, Rana Ibrahim, GMC number 7766928. Hello, I'm Dr. Ibrahim. How are you? Am I talking to Emma?
Yes, I'm Emma.
Hello, Emma. How are you today?
Okay.
Okay, Emma. Can you please check, can I check with you your age, please?
It's 27, doctor.
Okay, fine, good. So Emma, from the notes, I can see that you've been admitted to the hospital for a week. Am I right?
Yes, and I don't want to stay anymore in the hospital.
All right, I can see. Yes, one of the nurses told me that you talked to her and that you want to be discharged. I know that.
Yes.
So, Emma, please, can you tell me why?
I don't really think that I need to stay in the hospital. I'm okay. I don't feel any hotness, any fever, any chest pain, anything. I'm okay now. So why do I need to stay in the hospital?
All right, all right. Okay, Emma, so I'm going to answer your concern after a while, but please let me ask you some questions to get to know to your condition better. Are you okay with that?
Okay.
Okay, so can you tell me what happened, Emma?
I was having chest tightness and chest pain and heart racing as well.
Mhm.
Um, I decided to come to the hospital. They told me you have a problem in your heart and we have to give you medications. And I'm now okay.
Okay, okay. So right now you don't have any shortness of breath,
No,
any heart racing, any chest pain?
nothing.
Okay, that's great. That's great. And do you have any other medical conditions, Emma, apart from this that you came for the
No,
hospital this week?
no,
And you don't take any medications?
I don't take any medications. No.
Okay, okay. So Emma, concerning the reason why you had this diagnosis, which is in the notes, it shows that you have infective endocarditis. Do you know something about that?
No, they told me you have a problem, infection in the heart, maybe. Not sure.
Yes, yes, yes. This is the
Okay.
infective endocarditis. Yeah. So may I ask you, do you take any, do you smoke?
I do smoke, and that's why I want to go home. No one is allowing me to go to have even one cigarette in the non-smokers area.
Yes, yes. I can see.
I can't bear with this. I'm here in the hospital for 1 week without smoking.
Yes, yes, Emma, you have all the right to be furious about that because I know that it's difficult to cope without smoking right now, and I assure that I'm going to get to the bottom of this and to see your concern. But just a few questions, and I'm going to answer you. Concerning the smoking, can you tell me what exactly do you smoke?
Cigarette.
Okay, and do you have any other drugs like recreational drugs?
Yes, I do use heroin.
Okay, okay. And of course, this heroin is through needles.
Yes.
And may I ask you, do you share needles?
Yeah.
Okay, okay. Since when, Emma, do you use these drugs or this heroin?
6 months.
Okay, and can I ask, is there a reason behind that? Do you feel stressed? Do you have any problem?
No, I just feel like I'm feeling fine when I take it.
Okay, okay, that's okay. All right, Emma. After talking to you about your condition, I would just want to check whether you know what is the meaning of infective endocarditis. So, what's all do you know about that?
Infection in my heart.
Okay. And do you know that you have to take this medications, which are the antibiotics, to be treated from this condition?
Yes, just give me the treatment orally and I can manage to take it outside the hospital because I don't really think that this is a good idea to stay in the hospital. I don't want to stay in the hospital. Please, doctor.
Yes, Emma, of course, no one can force you to do anything. I assure you that. But it's my duty to give you some little pieces of advices. So I just wanted to tell you that, first of all, the oral antibiotic will not have benefit in your case, and that it should be given through IV. And of course, IV antibiotics are given in the hospital. So it's just a matter of time. You're going to take the medications and do some investigations, some examination afterwards, and then you're going to be discharged. Do you think you can follow this plan?
I don't really think, because I want to have a cigarette. You don't allow me.
Okay, we can see other alternatives to this. How about I can give you some nicotine patch or
No, no, no.
nicotine
I don't
gum?
want to use anything. I want to have a cigarette.
Okay, okay, I can see this. Okay, so may I give you like some minutes to go to the smoking area and have a cigarette and come back? Will this be good for you?
Okay. If that's the case, okay.
Okay, perfect. And after this, will you be able to take the medications? Are
Yeah.
you agree with that?
Yes.
Okay, perfect, Emma. I just wanted to tell you that your condition is going to be fine if you take the medications and if you follow some step after your discharge after the hospital, like whether if you can join some smoking cessation team or having a group therapy and try to
2 minutes
go on a
remaining.
plan to stop heroin taking. Do you think you can do this plan?
Okay, no worries. If you can help me in that, it's okay.
Okay, Emma, for sure I can help you. I'm here to help you, and I'm going to give you leaflets about how you can stop having these drugs, okay, and smoking. I can give you some links to NHS websites on advices how to stop smoking. And of course, this is not going to happen at once. This is going to be gradual. In order not to feel dissociated from anything, and I can give you some advices too about how to feel a little bit happy or confident in yourself without taking drugs. Do you want to hear about that?
Yes.
Okay, there are lots of things that you can do, like seeing some friends, like you're going to have like yoga group, doing some exercises, even
Actually,
getting.
doctor, I'm homeless. I don't have money to do all of these.
All right, all right. I'm so sorry to hear that, but I can help you with that. We can contact social services in order to find like a group of friends that you can join and talk to. Even this could happen even online. If you don't want to be physically in this group, you can do this online. And you can do various exercises like walking for 30 minutes per day, doing yoga, some meditation. I think that these strategies could help you to feel a little bit comfortable and a little bit confident without having to go back to use the drugs. So, do you agree on that?
Yes.
Okay. So, you're going to stay, Emma. Am I right?
Yes.
Thank you so much, Emma. I believe.
Move on to the
Okay.
next station.
Okay. Time's up. Thank you, Dr. Rana.
You're welcome.
So, how do you feel, or what would you say?
I feel numb right now. I can't feel my hands.
Why?
I don't know. Okay. I think it's not one of the hard stations. I think refusing is good. It's direct. You don't want to ask anything medical that much. So I think it's easy, but it's really stressing because it's always opposed by no, no, no. I don't want to. So you have to be, like you said, prepared. You have to have the scheme in your mind to know what you're going to ask.
Yeah.
And if I had the time, I was going to like tell her if she has any other symptoms, the red flags. I think so, but I don't know whether I have to say it or not.
Good. Okay. So, I do agree with you. These cases are easy if you do them in the right way.
Yes.
Okay. So during the consultation, you did, as you all of you, doctor, as you can see, uh, um, the flow of the station was not as you have learned. Okay. We can't say that you have to say to ask first why, then you respect, then you talk about risks and benefits and really understand.
Begin.
It's not a kind of thing that you have to do it by order. It comes naturally with the flow of the station. But during the station, you have to show these main points. Okay. I'm happy with the start of your start of case of the case. It was really good, and you started with a really nice smile. Okay. Your interpersonal skills or your communication skills are very, very good, very nice, Dr. Rana. Okay, and you are prepared. You have a kind of um, confidence in answering the questions or the unexpected questions, and this is really good thing. All right. You checked the mental capacity or her understanding about her medical condition. You told her about the importance of staying at hospital, and the treatment is only through the veins. Um, you touched on the advice of stop smoking, the advice of stop heroin. Okay, you gave her an advice based on what she thinks about misusing of heroin. I was happy with this. So you've done a really nice thing during the station. You were not insisting on convincing her. Okay, you didn't make a pressure on her, and this is a really good thing. So you fulfilled all of the main points of dealing with a refusing patient. The only thing that I would comment on is that uh, you were trying to take history first and then addressing her concerns afterwards. You told me,
Yes.
okay, I can see how you blah, 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 blah. I will answer you after a while. Okay. This might lead to more insistence, or the patient will be more
Mm.
refusing or
Yeah.
angry. Okay. So if you just tell her, all right, I'm going to this is your right to if you don't want to stay at hospital, it's totally okay, and we have respect to respect that. But and I'm here to address this, okay? But can I check if you are okay to go home, or if you have any
Yes.
other concerns to address it, and then we can discuss going home together, okay?
Mhm.
It's better than telling her I'm going to answer you after a while, okay? This is the only comment that I would say. Also, in cigarette smoking, um, you told me we can think about it or we can talk about it, but can I ask you a few questions?
Mhm. Mhm. Yes.
Okay.
Yes.
This is her concern.
Yeah.
This is her concern. Tell her, okay, no worries. Regarding the smoking, we can let you go to smoke. Personally, I don't advise you to go because as a doctor,
Mhm.
this is not the good advice to give to you. But if you want to go to have a cigarette, as you did, okay,
Mhm.
but you've
Mhm.
done it later in the
Yes. Yes. Yes.
okay?
I understand.
This is the only thing that I would comment on. Other than this,
I
everything,
forgot to ask her whether she has a family, she's homeless. I forgot about that.
yeah,
She
this
told
is
me at the end. Yeah, and
I
I
told
think this
you,
is important. Yeah.
yeah.
Mhm.
Lastly, the she is misusing heroin. She's sharing needles, so screen her for bloodborne infections. Okay, so it's one of the medical treatment in this case.
No,
All
I
right.
didn't have the time to say anything in the medical treatment. Yeah.
Yeah.
Hmm.
Okay. You can. The only thing that you need to say is just you. So I think we are going to you are going to stay in the hospital, give you the treatment, and then if you would like, we can screen you for blah 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 blah, and we can talk about misusing alcohol
Sharing
and
needles. Mhm.
misusing heroin and cigarettes. Okay.
Okay.
So Yeah, but well done. Well done, Dr. Ron. All right. Do you see the mind maps or not?
No.
No, just the screen of the question.
Can you see this? So these are the main things during any case of refusing patient, respect and why. Dr. Rana did that. Data gathering in this particular case, you recap what happened, how is she feeling right now, if she has any shortness of breath, any fever, any chest pain to explore the red flags. During the data gathering, please highlight the IV drug abuse. You can ask it in the present history if you would like, if you feel that it is the right time to ask. If you feel not, you can ask about it in the personal history. Okay. In the personal history, the only thing that you can ask is about smoking and drug use. Since when, how much, do you share needle or not? Psychosocial, please. In this case, she's drug abuser. Ask how is she managing, and who does she live with? All right. Ideas, concerns, expectations. You can ask her, do you have any idea about what do you have exactly? All right. Do you have any other concerns and expectations? You can ask it at the end of the station if you would like. All right. Examine her. You can examine her. If you don't examine her, this is not a big deal in this case. Okay. But it will add to your data gathering marks. But if you don't do it, it's not, the main issue of this particular case. Mental capacity or understanding, you've done that, Dr. Rana. Then you told me the solution. She wants to go to have a cigarette. Go and have a cigarette. It's okay. No problem in that. Then if she's insisting on not staying at the hospital, then you can talk about benefits and risks of staying in the hospital. But she was okay. Once you told her, go and have a cigarette, she was okay with this. You were not pressurizing her. No need for the senior, no need for discharge against advice, no need for yeah, even safety netting. She's going to be in the hospital. Okay. What is the medical treatment? Keep admitting her, continue treatment, monitoring, and advice on IV drug misuse and smoking cessation. In IV drug misuse, you just tell her, we can screen you and we can help you in quitting drug. That's it. Okay. So yeah, well done, Dr. Rumi. If I would give you marks, interpersonal skills 4, management skills, I would say 3. You missed a few things in the management. Data gathering 3 as well. Psychosocial, I prompted you, but yeah, 3, 3, 4. Well done.
Thank you, Doctor.
Good. Okay. All right.